Well, hello, everyone. Good morning, good afternoon, wherever you're joining us in from today. It's a pleasure for me to welcome you to our session today, Doctors Rosslynn Zulla and Andrea MacLeod, who will be discussing their work on developing guidelines to support immigrant and refugee families with neurodivergent children. Their project addresses the intersection of two marginalized identities and focuses on fostering strong relationships between researchers, service providers, and immigrant communities. So please join me in welcoming Doctors Zulla and MacLeod to the session today. And with that, I will hand the virtual podium over to you.
Great, thank you so much. I'll see, Roz, if you want to share your screen. Great, so we're so glad to have all of you here. Before we get much further into the presentation, we'll be talking about working with each other, our families and our communities, and really focusing on relationship building in partnered projects. Move to the next slide. So both Roz and I and our collaboration is grounded in where we live and work, which is Amisquatchie, West Cahegan, which is also known as Edmonton, located on Treaty 6 territory. As part of our process of reconciliation, we really work to recognize the wisdom and knowledges of Indigenous peoples who have made these lands their home for thousands of years. As we move through January, we know from the Cree calendar that the full moon in this month is called the Spirit Moon, and it's linked to a time of connection and reflection. So there's a lot of nice alignment with the work that we'll be talking about today. And during this time, our Indigenous communities, our Cree communities, encourage us to reflect on who we are in connection to our relations, to our land, to water, and all of creation. So as we move forward, we'll think a little bit about that too. So we'd also like to thank all the families and community leaders and service providers who've spent time sharing their stories and their recommendations for creating these inclusive and safe spaces. And we'd like to thank our funder, Child Right Network, for their financial support and flexibility throughout this project. So in this work, we really want to highlight that we'll be sharing the story of how we've worked together, how we've co-listened, co-acted, and co-reflected. So this is truly a research partnership. Roz and I are affiliated with academic institutions, myself at the University of Alberta and Roz at the University of Calgary. We've worked with our community partners and community members through Multilingual Abilities, Newcomer Center, Multicultural Health Brokers, and Catholic Social Services here in Edmonton. And this is a picture of our beautiful team. We've been meeting, we meet once a month, and we've been doing that since 2021 to work on various projects that all interconnect around the experience of being a newcomer and the experience of having or being a person, having a child who's neurodivergent or being a neurodivergent person. So as we started our work together, we really realized that there weren't many, the guidelines that existed were very few, and then also not very explicit about how to support relationship building in research. So to increase interest, to do research projects to support families of children with disabilities, including immigrant and refugee families with neurodivergent children, and how to do that in a way that's going to include and really bring in a really broad range of perspectives and build those relationships so those perspectives are interwoven in the research. There's also limited guidance for researchers to work in a way that's meaningful with immigrant and refugee families with neurodivergent children from diverse backgrounds. In particular, we really explored engagement protocols throughout the research and thinking about study documents. So as we work together, we're a pretty big team. So even though we're in the same city, we're living in kind of different parts of the city. So we've met online for the most part. And the way that when we began the process, we really wanted to talk about, well, what should a research partnership be about? And really spend some time unpacking our experiences. So we engaged in team reflection using Zoom to unpack and make sense of our past experiences in building relationships and undertaking research. What worked well, what was challenging, what created additional boundaries or and barriers to taking part. And we heard some really important messages around trust, dignity, research that drives change, research that's capacity building, the importance of flexibility, mutual respect, personal space, managing expectations, and an array of thoughts. And these pieces were some of the building blocks that we continue to explore as we move towards our guide. So today we're going to be sharing about our guide. So some of the strategies we learned, but we'd like to frame it also as a discussion. And so we have a few scenarios and we are going to present them and then ask for your thoughts, your inputs, your experiences as we step through. So I'll pass it on to Roz for the next slide, I think.
Thank you, Andrea. So what we'll do for these scenarios is I'll read some of the scenarios, and I know we have about 19 people. So I'll just ask, people to just raise their hand. So, and you can just give like a few examples of, what you would provide in terms of solutions. And then after that, we'll just present some suggestions. Now, one of the things our team has always emphasized was that, we always want to learn from other people. So we're not thinking of all these guidelines as like, okay, no, these are strict rules that need to be followed. These are rules that we need to continue to have a discussion and learn from each other. So let's start with, and I think this is probably something that everybody's experienced in the past. So a researcher is interested in doing a project that addresses the health and well-being of immigrant and refugee families. As this is the first time for the researcher to do this kind of project, the researcher has multiple questions, many that focus on how to approach families, what terms to use, and what frameworks to explore issues. As a representative of a settlement agency who has extensive knowledge of working with immigrant and refugee families, what are some suggestions that you would offer to the researcher? What role would you play in realizing any of these suggestions? So I'm just going to invite people to share some of their perspective. Now you could do this if you don't want to speak, you can also do this on the chat and then we can read some of the responses. If you're willing, you can, turn your camera on and then just share some of your perspectives. So what were some suggestions that you would probably provide to this eager researcher who wants to work with families?
Yeah, so in the chat, thank you, Suzanne. They've suggested, I would suggest that the researcher ensure that the materials are in the language of the family's choice. It's a really important proposal. Thank you.
Okay, can I say something?
Yeah, sure.
Okay, this is Elham Farah. I would suggest to ask about lifestyle and also lifestyle and food intake and pattern of behavior.
Very good. More information about the family. Anybody else?
I see Michelle suggesting to take opportunities to attend community organization events as a listener and learning if possible before there are any asks.
Yeah. Agreed. This is exactly what we had done and spent most of our time. Pierre.
So I guess following up on what Michelle was saying, my suggestion would be something to the effect of understanding the cultural context a bit more, that you you know, before you get your ask out there, sort of understand where the community is coming from, what they look for, so that you know, your approach is a bit more targeted and specific that way.
Right. Yeah, we actually had to go. So Andrea and I have spent times with these communities, you know, I would say approximately 2, 3, even more years. I don't want to say how long I'm on the community, but I would say that it's, you know, when we were really in developing our understanding, it was not so much as academics understanding each other, but also community members understanding what research processes are and what that really means. What does it mean to make knowledge and to make change together? Even the simple task of unpacking terms was really important. What is neurodivergence? What is autism? You know, what are even some of these financial and economic and sociological costs when we use these labels in research and in daily lives? I don't know if there's anybody else that wants to, maybe just one more.
I think there's a few here in the chat that connect around emphasizing the trust building process and how important that will be, and linking that to previous experiences with of the community with government and authority figures as part of that trust building process. And getting some more information about the community, for example, through de-identified demographics, for example. This is great. Really good suggestions.
I'm actually wondering, you know, these are really great suggestions. If you were a member of the settlement agency and you talked to this researcher, what role would you play? We did hear the role of, you know, just giving more guidance, but is there other roles that you would take on?
That would be more of like say a broker, since you've taken the time to hopefully establish some trust in the community, to be sort of that, maybe perhaps that bridge between the researcher and the group that is being contacted.
I think that's a wonderful suggestion, Pierre. And when I was first starting as a researcher, what did I have to do? I connected with cultural health brokers, and they took me on rides from this community event to that community event to this community event. So you got a real sense. I think one of the importance was that people needed to see you not just as a researcher, but as a person who had similarities with families, who you know, there's one thing that people will say, think a lot of community-based researchers and community practitioners say this: we need to see you as a sister, as a mom, as an individual, as a parent, as a friend. Those are all those ways that we relate to each other before we actually do a research project.
I think that aligns well with what Ilham is talking about too, of being more understanding and not judging. So trying to come alongside rather than kind of working to. Yeah. And Suzanne has noted as a settlement representative of a settlement agency, thinking about being a protector and a conduit. A convener was suggested by Diane. So these roles are multiple in our partners who are part of the settlement agency landscape too.
Okay, thank you, everybody. We're just going to go from, so as I said before, when we started this work, we had spent some time really unpacking terminology that we used. In regards to trust, we had a really critical discussion about, what is our experience with researchers, and then how did we feel validated? And that was really important to illuminate, how you build trust from the beginning of a research project to throughout and to the end. And for us, it was really about understanding that relationships are on a continuum, regardless of whether or not we are in a research project or if we see each other outside of the research project. And I think one of the things that people have highlighted was getting to really know the families. And for us, it was really understanding that pre-migration and post-migration experience, to really understand the holistic experience, but also to understand that every family is very unique. And so it's really important to be attentive to those unique spaces and experiences. The other thing that we wanted to point out was we noticed, particularly Andrea and I are in the areas of health, and a lot of what we engage with in our research, and this is also occurs with many of our community partners, there's a lot of focus on deficits, the challenges that families face. And while that is very good to illuminate, it also can have some implications on how families see themselves. And so we really wanted to point out what is really important, just as much as you do illuminate challenges, it's also important to understand that there's a lot of assets that families bring. And there's a lot of assets that families use with their communities. We just recently finished a project on families navigating public spaces. And, I would say that when we started analyzing the themes, we found that there were as much challenges as much as there were assets. So people were able to, find ways to help themselves navigate public spaces as well as use community resources to navigate spaces. So it's always important to try to find that balance and to illuminate at the beginning that, really when we're looking at social change, we should also really look at assets and the strengths that families bring. One thing that I think everybody always focuses on, well, what kind of theory am I supposed to be really focusing here on? And I think what our team would say is, we don't really want to be prescriptive here, but it's really what we started to do as a team was to try to figure out what are we really trying to change here? Is it, our knowledge, our habits, or is it more broader, like how the organizational policies that some agencies have? Is it even just the service delivery infrastructures that we're trying to change? Are really looking at specific discourses that shape how families should act when they're requesting for services or even feeling validated. So I think what we really wanted to just highlight is what are the key things that your groups are really looking forward to and addressing, and seeing how those key goals and outcomes really relate to the different theories that we have. Now, I do say that we're very much critical in our shaping when we look at research project, and that's largely because our group really wants to focus on systemic change, systemic and structural change. So we often use community cultural wealth, which focuses on the assets that families bring and how they navigate reality. And then also disparate, which focuses on how specific differences are navigated on a daily basis. One key thing that we do want to illuminate here is whenever we're looking at theory, we even in Andrea and I, some theories we find in our disciplines to be more popular than other theories. And so it really invited a discussion of, what has our discipline, what has even our community really aligned with? And sometimes that's can be a difficult task, but that's also a good reminder to also just really, I often say, really unpack what we know, what we understand, what are our theories that really thrive in our discipline, to just really unpack that and say, well, what's the benefits of this and what are some of the limitations? Okay, go with
Maybe, Roz, just to add to the previous slide, because of the really intercultural nature of our work and our collaboration, the coming at even understanding neurodivergence or disability from it couldn't be from a purely medical model because of it was very clear to us that the perception of disability was also filtered through one's culture and one's often pre-migration groundings. So the experience, the social component of the experience of a disability was really interesting to it not just being reminded of, but that was a reality of a lot of the families that we were working with. So really thinking about being aware that our way of seeing the world is informed by, you know, the theories that we do rest on, and really being open and exploring different ways of seeing things was important.
So the next scenario, this is where you fleshed out your theory and now you're moving on to a study design. So having finished the study design, your research team must create study documents. This includes creating any recruitment materials, posters, or emails, study information, and consent forms. Given the diversity, so that could be the ability, the language, the dialect, the literacy skills, the cultural customs and engagement among immigrant and refugee families with neurodivergent children, what are some factors that are integral in designing meaningful study documents? And what would your study forms look like? So again, feel free to share your thoughts on the chat. You can also speak up if you wish to.
Okay, I have suggestion, if I may. Okay, again, this is Ilham. The reason for the meaning of the study, I think for policymakers, for education, and for healthcare, because the symptoms, the root cause of the symptoms, it looks the same, the symptoms, but the root cause of the symptoms, it's not the same. It's for treatment.
And that's really important to highlight. Thank you.
You're welcome.
Anybody else?
Michelle in the chat says that image selection, literacy level, and languages used were all important when trying to recruit. And that for sure resonates with us, and that aligns with some of the comments Suzanne was making earlier around really thinking about language or interpreters as part of the study process.
Anyone else want to?
The chat, Jonathan says, I think using plain language, including information about the study goals and potential benefits, personal or for the community, are important, and also including information about privacy safeguards and equity considerations. So I think those are some really key parts, and those are things that we often include, but I think that in plain language is a really important component of that thought process. Yeah.
And thank you for highlighting privacy concerns. A lot of what we've always found with our families that we work with is confidentiality is really important, particularly as, you know, some families are willing to share, but also there is still that stigma around disability, and that it's, you know, could be, there's different interpretations of how people see that disability when it comes to their families. But we recognize that not only are families navigating these stigmas, but also they've already had some relational challenges because of dealing with that stigma. So really being attentive to the confidentiality and the ethical piece.
Michelle adds that they have opted for a verbal consent to ensure that the details could be explained and families could ask questions from someone they already knew and trusted. I think it's a great approach to think about that part of you know, embedding or thinking about how the research can be how to build on the trust that already exists in some relationships to be able to move forward. Yeah.
And I think the verbal consent is really important. One of the things that we found when we did data collection is that families really, when families get to know you, they really want to see you in person sometimes. And I know that I've already had some family interviews. Some of it is because an example is we've heard some very unfortunate service delivery challenges that families experience. So now that they're meeting another person who has an authority of power, it's really important to build that face-to-face trust on an ongoing basis. Okay, we'll take one more example.
Maybe we're good to move to
Okay.
we were up to. Yeah.
Okay, so one of the things that our group had really emphasized was because we have families from diverse communities, we want to be able not only to have clear language, but also to generate these study forms using pictures. Now, the challenge is that when we have ethics boards, they want us to fill out all these, make sure we complete all these key areas and say specific words. So we really had to find a balance with our ethics boards in terms of what information needs to be on the consent form versus what information can we visualize. So this is actually the sample of a study consent form that we used, and we tried to do as much pictures. And I know that there are some texts. And so again, it's just trying to find the balance. But actually it was actually Andrews University, the ethic boards that really, they were just said, oh, wow, that's an amazing ethics consent form that you provided. So it's, what we emphasize is really trying to use pictures, a lot more visual ways of engagement. And also thinking when you speak to families, what are the ways that what's really important? And obviously in-person contact. And so when we started doing the study, a lot of that was working with the cultural health brokers, the youth brokers, to provide that in-person, first-person contact. Yes, we had to draft posters, but a lot of it, again, was through in-person contact to see who was really interested.
And with our, sorry,
Go ahead,
with
Andrea.
our consent forums, what was really helpful, and this was something that I've experienced as a researcher when I've worked across my languages, but also was shared by different members of the team, is that feeling of when you're interpreting or interpreting a form for a family, that when it's a very dense written, it really feels like you're not being consistent in terms of your the relationship that you've built. So you're saying this is, you know, this is accessible research. It's important for building knowledge about the community. This is really going to help other parents. And then we've put them in front of a form that's very densely text, looks very formal, can be a little bit, it looks very bureaucratic. And then they may not be able to read it. And so we're interpreting it for them so that there is that sense of misalignment. So with this, this approach to our ethics made it so that what we were saying was easy to interpret for a person. They could read it and then speak it quite clearly. But then also the images aligned with what the parent was hearing. So, you know, we're looking at how your child is navigating spaces in the city. So the images align with that. So there's that sense of, okay, we can trust not just that the interpretation is accurate, but it does align with the document as well. So that was definitely an exploration of whether that would work. And it certainly helped us in our process and was supported by our ethics board, which was really encouraging.
Yes, Alan.
Okay.
Yeah, just to clarify, so are you saying that you did not have to provide one of these detailed, dense consent forms for the REB then?
So what we did was we shared with families, you know, what the study was, and then we spoke about what the project was. So everything that you would see in a consent form was done through verbal first, and then they would see the form.
And then, but the form looked like this, what we're sharing on the screen, that was it. So we were hitting all the key points that were required by our ethics board. And then, but in simple, plain language, and then also embedded with photos. So it took a little bit more space. But when we justified it on our, for our ethics review board, we clarified why we chose that approach, and they supported us in that.
Okay, so the end result form was something that was probably maybe not 12 pages, but maybe more like 16 or 18 because it included photos. And is that, I just want to make sure I'm getting it right.
Yeah.
Okay, thanks.
Yeah, great question.
Okay, I have another, it's a question and a concern at the same time with regard the integrity of the information and the honesty filling those paper. So because there are so many cultures that when a child have like a problem with focus, with attention, so family, they don't admit that he has problem. So I've seen, I'm a retired teacher anyway. So I've seen denial. So how to deal with that?
I think in our case, that was where when we the working with our community partners to approach families that were ready and in a situation where they were comfortable sharing about their family's experiences. So they may have been at a different place in that pathway.
Okay.
And that was really helpful. So I think, you know, even some of the questions that we asked them was, how would you support a family that was beginning to experience or beginning this navigation? So they were able to position themselves also as, you know, building on their expertise and their experiences.
Yeah.
But I think in simplifying, it's very important that the information is still clear and aligns with the goals of the project. And then really being thoughtful about, you know, who are we approaching and how that's done. And again, I think those community connections are really helpful for understanding. Even in the words we use, we specifically chose the term neurodivergent to really think about it in a less a more inclusive approach. But so for
Yeah.
some families that wasn't a meaningful word. So we had to break down, well, what are ways of describing that for a family or a community member? Yeah.
Thank you.
Question.
Okay, I'm going to move to the last case study. So this one just really focuses on the stage where now you're ready to share knowledge. So your team completed the study. They've generated rich learnings that can be shared with a variety of groups, which may include immigrant and refugee families who have neurodivergent children or youth, service providers who support them, policymakers, and decision makers. So who would you now start to deliberate? Where would you share this knowledge? And then how would you share this knowledge? Just wait for a few responses. Again, feel free to open your video and you can feel free to share some. Or maybe what are some considerations you would provide in order to determine where you would share your learnings or who you would share the learnings with?
Yeah, great. So we have Alan is suggesting that co-presenting the findings in community settings. It's a great suggestion. Sharing it with educators, Alan suggests. Michelle talks about prioritize sharing back with the people who contributed to the project, and then the community organizations who supported the project. Yeah. Thinking about policymakers. So we're talking to folks that think about this too, right? So it's not thinking narrowly in terms of academic dissemination, but much broadly. And Suzanne is talking about creating infographics to publish in ethnocultural publications like newspapers and websites. Yeah, really great suggestions.
One more suggestion?
Yeah. Michelle added sharing in a variety of methods, including publications, but also videos, lay summaries, translated documents. That's great.
Okay.
Oh, and Jonathan, sorry, says, I think a format and highlights to share that would need to be adapted to different audiences. And then considering the different venues for sharing also. Yeah, so not just having a one output fits everyone, but being more aware of that. Oh, and then Pierre raised his hand, so let's hear from him too.
Well, almost not too off topic, but just I guess more of a follow-up question to that scenario. I'm wondering, and maybe it's not relevant to your project or perhaps to your experience, but I was just wondering if you have a key decision maker demographic, perhaps that you're targeting the messaging towards. Like what do you do when they don't show up, or they aren't really that engaged in perhaps what you have to say?
I think when they don't show up, it's usually we go, so our group is composed, not only are they caregivers, but they're also very vocal community leaders. So they have connections to the local government and the provincial government. So they will follow up with you and just have coffee, have those ongoing conversations. So I would say we're actually very lucky that many of our members, they're vocal leaders, but they're also recognized leaders. So a lot of people know them. And I would say, if people don't show up and there is a key demographic that you're looking for, try to follow up with them, have a coffee, going back to that way of building relationships. For us, it's always starting with the coffee or with the meal or coming over to their house and just sharing what can you do to support the community. So one of the things, oh, Pierre, you still have your hand up. I don't know if you have another question.
No, that's a legacy one now. Thank you.
Hi.
Oh, and I see Tom has his hand up. Go ahead.
Okay, thank you. So I do have a question around, because a lot of this is about cultural sensitivity, which is obviously very important. Sometimes there might be results that come up in a study that could be, it could feed into stereotypes or what have you. But it's important information that could be very helpful for policymakers and such. What do you do in those circumstances? Because I don't really have an answer for that, but I think it's a really important question to ask.
I think in our experience, bringing those, that's part of having in our partnership, being able to have that conversation with community members. So like like one perhaps that aligns a little bit with that is that within some families, within some communities, the experience of the stigma related to the disability. And so being able to have that conversation about, so we're observing this, how do we talk about this? How do we talk about this within our community? Are there some cultural perspectives that can help inform how we share that out? Are there, and then how to frame it, like, are there ways to frame it as definitely a challenge, but that there's also these supports or next steps. So it's not just landing the challenge, but framing around it also in terms of what are strengths within the community that can help address it. So some of the communities that we've worked with have not related to specifically to the work that we do, but have experienced some gender-based violence. And one of the things that we can speak to is that this occurs within the community, but also that there are community supports to help women who are experiencing it. So, perhaps the next question is, well, how can we better support those community-driven initiatives as a next step? So, I think not glossing over, but also really taking time to talk through that challenging result is really important.
I'm also going to add that sometimes when you do the research, you always have these specific organizations that don't work well with culturally diverse communities. And I think, again, to what Andrea said is, we actually, our group is connected with different organizations. And we do know that there are some that are just like, absolutely no, we just heard horror stories. And so to what Andrea said, really, it wasn't about glossing, but we have those personal connections with the managers and share those results and find ways to really frame what we're learning from them, and not to see this as, oh, this is, this is the result, but just to figure out how do you frame this, but how do you work on the next steps? What would the next steps be to address some of these problems? And I've been in research conversations where they're like, yeah, I know our organization does this, but I think what we want to emphasize here, it's that relationship that you're building. And so if anything, the findings are spaces to stimulate that dialogue, to say, well, how are we going to build that relationship now that we know? Or, now that we've already stated the obvious, how are we going to build out those next steps in that relationships that we have? So on this slide, one of the principles we have focused when we started figuring out, okay, how are we going to share our learnings? What are we going to do? when we started unpacking what research meant to us and how we shared research, we thought about those, everybody knows this. You attend a conference, you get to be a speaker, you speak for 15 minutes, and we felt that, yeah, that's a good opportunity, but we want to have more dialogue and be more dynamic. And so one of the key principles we said is every time we do a research sharing, it's really important to recognize that both presenters and the people who listen to the feedback are active learners. So there's opportunities for people to share and give feedback, and to engage in conversations. And the other thing is we needed to find ways to create dynamic. So things that were, we call this, we need to create knowledge products that nourish our senses. And I know that might be a hard concept to understand, but it's really this idea of we looked at ways in the community where we shared learnings and learned about each other. And a lot of that was sitting in circles, being around food. And so we wanted to incorporate those principles where we have stimuli that focuses on activating all of our senses and all of our sense of wanting to come together and to learn with each other. So what you see in this slide is really a poster, and it's designed to be, it is actually a life-size poster, and it looks like a map when you see it. And what we found is we just shared, we put this up in community engagement picnics. So as part of our ongoing partnerships, we have regular engagement with our communities. And really that's about community, inviting families to an event that, it's not only about sharing the research, but also it's about connecting with each other around meals and any topics that they're interested in. So when we presented this map, it was very interesting because a lot of the children would come up and say, oh, okay, oh, this is a nice place to navigate. And they would trace all the roads. And so it became a conversation piece for us. And so really that was really what we wanted to focus, that it is a knowledge products are stimulus for dialogue, for continued dialogue, to determine what are the next steps. What would you like to address? How does this reflect in your community, in your reality?
And we shared this poster as well we shared it at Metropolis, where there's a lot of service providers that attend, and also within the city of Edmonton at a meeting that was sharing different research that was funded in part by the city of Edmonton. And there was different administrators that work within the city, and it was really interesting to hear from them about how disconnected they were. So there's folks that really think about inclusion and services within the city, but they're a different team that think about recreational services, which is a different team that thinks about transportation. And so our families use all of these, and just the conversations we had was how important it was for them to start talking between each other within the city so that they can be better prepared and better able to support the families that we were working with. So these different avenues for discussion were really important for us and for our team.
I know we're running out of time, so we're just going to focus on this, on the finishing of the presentation. I'm sure this is a key theme that Andrea and I keep talking about. So really, projects are spaces where we start to discuss what is meaningful for us. And when we take a look at it, every opportunity that we have in the research project is a stage to develop what that meaning is. I would say also too, we always have reflection at our meetings, and it's really key because it helps us to stay grounded in what we're doing. So, along with the slide, we'd also say, try to find moments of reflection to keep yourself grounded, and also to unpack some, assumptions that you thought, oh yeah, I thought these were good, but maybe these don't necessarily work. So I think, Andrea, if you can put in the chat on the website where we have our guideline, we have a written guideline that's available online for people to view. We also have a video that's coming up that will just talk more a lot about these principles. And the reason why we thought about the video was we do have a lot of stakeholders who really enjoy that interactive component. And so that's really for us, we just wanted to say here's the written guide and here's the video guide. The video guide talks about key concept, but the written guide is more of the extensive space. And then otherwise, that's it. So thank you.
There's any questions for remaining time?
Thanks very much.
Yeah, I want to thank you both, Rosslynn and Andrea, for joining us today. It was great, great talk. Happy to hear about your project, and really thankful for you sharing the document that you have. And yeah, so if anyone here needs to access it, the link is in the chat. We'll also circulate it with the recording afterwards. But yeah, looking forward to the videos, which are a nice synopsis, and hopefully that can at least start the discussion for folks. But for everyone else who joined us today, I just want to share the feedback survey with you. So feel free to share any comments or thoughts you have on the session today. And more importantly, if you have any topics specifically that you would want Child Rights Training Program to explore and offer in a future session, do leave your comments there. Alternatively, you can just send me a note, send me an email, and I'm happy to connect with you on that. Now, before we sign off, I just want to flag that we do have a session coming up on February 11th, which is the first part of a 3-part series on patient-oriented research communications. So if you are interested in that, feel free to follow the link and sign up. And of course, if you need recording, those should be available afterwards as well. So with that all said, I want to thank you again, Andrea and Rosslynn, for relaying your efforts today, and for everyone here for attending and participating and interacting with us all. So with that said, have a wonderful rest of your week, and hopefully we will connect again soon. Take care for now. Bye.
Thank you.
Thank you.
Thank you, everyone.